Well, where you live may impact your brain health. That is according to a new study from the UW School of Medicine and Public Health.
The research published in the Journal of the American Medical Association Neurology is among the first to demonstrate how living in a disadvantaged neighborhood can actually impact your brain. The study was led by Dr. Barbara Bendlin and Dr. Amy Kind, Associate Professors of Geriatrics at UW Health. Welcome to both of you.
Welcome to you both.
We were just talking about stress and heart, but stress apparently affects the brain as well.
It certainly can, and certainly living in a highly disadvantaged neighborhood increases risk for exposure to all sorts of negative impacts. So we were thrilled to be able to get this work published.
Dr. Bendlin, tell us about the study. What were you looking at specifically?
We were looking at participants who live in Wisconsin and who have been part of large research studies in Wisconsin where they come in, they do memory tests, they do brain scans. We can look at factors that increase and decrease risk for disease or brain changes. And in this case, we looked at where people live to see how that had an impact on their brain.
And where they live, what kind of risks does that present?
So living in a place that's highly disadvantaged means that the area has more difficulty with housing quality, more difficulty with education, income, poverty, and employment. And with that comes increased stress. Different types of toxic exposures can happen. Different types of barriers to positive health behaviors can be there. It may be harder to exercise, harder to get safe and healthy foods. And because of that, risks for certain types of diseases are much higher. But this was the first time that we looked at brain health in this way.
Wow.
And what did it show? I mean, what did it specifically show you? That if you're struggling in poverty, you're at a higher risk for brain impacts?
So what we did was we looked at brain scans that tell us the volume of certain structures, total brain size, but then also regions that are important for memory function, for example. And then we looked at the relationship between where people live and the size of those structures. So we saw smaller volumes for individuals that lived in more disadvantaged neighborhoods.
So is it rural versus urban sometimes?
Sometimes. Highly disadvantaged neighborhoods tend to be concentrated in inner cities and highly rural areas.
And these are all Wisconsin people in the study?
These are all Wisconsin people in the study. The changes in the brain that we saw were equivalent to 4 to 7 years of extra aging.
Really?
Yeah.
But what is the solution to that? What is the remedy for that? I mean, that's a complex, complicated problem, isn't it?
It is.
Absolutely.
And Barb and I will continue to be doing research in this area to tease apart some of those mechanisms. But for now, certainly we know that healthy living is important for more than your heart. It's definitely important for your brain as well.
Fascinating study, and it will continue. Look forward to an update.
Please come back as the study progresses. It's really fascinating
Dr.
research.
Thank you for being with us.
Great to see you. Have a good weekend.